Morning, everyone, and welcome to this webinar about launching the development of Population Research UK. I'm Ben Gordon. I'm the Executive Director of Hubs and Data Improvement at Health Data Research UK. And I'm joined by a number of different panelists today. So with me, I have James Pickett, who's the Hub Development Manager at HDR UK. We also have Andrew Morris, the Director of Health Data Research UK, Chelsea Sinkagrani, the Senior Policy Manager at ESRC, Catherine Moody, the Head of Population Health at the MRC, and Mary De Silva, Head of Population Health at Wellcome. So we're initially going to have a welcome from Andrew, and then we'll hear from each of the three funders in turn, just giving a bit of an overview of the vision for Population Research UK. And then James and I are going to talk through in a bit more detail the sort of next phase of this programme. To give a bit of a kind of housekeeping intro, we are recording this webinar. So the aim is that anyone who's unable to make this slot today will be able to view the slides and recording on the HDR UK Population Research UK webpage. And any questions that you have, please post them in the Q&A function. I'll repeat this during the Q&A later on, but as you may be aware, this is the launch of the engagement process. So we're unlikely to have answers to all the questions at this stage. So we will, where we can, we'll provide answers during the webinar, but we may take, not just may, we're very likely to take many of these questions away and answer them over the course of the engagement process. And you'll hear more about that from James and myself later in the webinar. So I'll now introduce Andrew Morris to give the welcome and vision from his perspective.
Oh, thanks, Ben, and a huge welcome. So I'm Andrew Morris. I'm Director of Health Data Research UK, and a real pleasure to be asked just to say a few words and thoughts. I do think this is an important day. If we get this right by working in partnership at scale, I think it could introduce a step change in the UK's capability in terms of cross-sectoral science. And also it will advance open science practice, not only in the UK, but internationally. So firstly, a huge thank you to you for joining. I see we've got over 100 people online already, which is terrific. And as I say, it's only 374 days to Christmas because it is a challenging time of year. So thank you for making time for this event. So we're launching a consultation phase for PR UK because the aim is to maximize the use and the impact of the UK's world-leading large-scale longitudinal population studies. We're hugely privileged in the UK. We've got the work of, for example, ADR UK, the UK Data Services, Closer, DP UK, amongst many other longitudinal population studies. But if we can enable these to be more coordinated, the ability to work across studies with no additional effort, it will really enable the research ecosystem at scale. And I think that's the essence of PR UK. And we're very honored to be invited to enable and to convene the community to define what does excellence look like across this UK ecosystem. As we know, we've learned a lot from COVID, and I think what COVID has exemplified is the need to work across disciplinary silos. I think we've been very good if one considers COVID as having four harms. The direct harm associated with COVID is well articulated, the impact on the NHS or even non-COVID related harm. But where we need to be better aligned is to define the economic and social harm of COVID. And even at this next phase of the pandemic, I would argue the success of the vaccine program will not be dependent on the biomedical findings. It will be equally dependent on the behaviors of the population as a whole as vaccines roll out, the impact of behaviors within households, and the take-up of vaccination and characteristics of non-take-up. And that will require partnership working across biomedical science, behavioral science, social science, and economic science. So I think COVID has been a wake-up call, and that's why the launch of PR UK is so prescient. So a huge thank you to the funders, ESRC, MRC, and Wellcome, for not only coming together, but to have the vision to say, let's work in a strong, coherent partnership to make PR UK happen. And you'll be hearing from the funders in just a moment. Can I just credit them for that partnership working? I think we've got a wide audience today from across the community. So this is not about, although HDR UK has health in its name, this is about cross-sectoral data science to really enable PR UK to be a huge success. So can I thank you for your interest? There's a lot of consideration over the next wee while in terms of interoperability, all the interesting stuff, data standards, APIs, core system interoperability, the stuff that gets me very excited. But we need to get that right if we are going to develop and maintain the integrity of an outstanding population research ecosystem in the UK. So thank you for your interest, and when it does come, happy Christmas. So I'll now pass either over to Ben or to Chelsea, I think, from ESRC, who is going to set out the vision and perspective for PR UK on behalf of the funders. So a huge thank you.
Thanks, Andrew. So yeah, I'll pass straight to Chelsea. Thank you.
Hi everyone. As Ben and Andrew both said, I'm Chelsea and I'm a Senior Policy Manager at ESRC. I'm really pleased to be here today and for HDR UK to be leading on this development phase of PR UK on behalf of us three funders, ESRC, MRC and Wellcome. So PR UK is a really exciting and timely investment, allowing us funders to collaborate and work towards our shared strategic priorities, which are focused on the need to improve data curation, data linkage and interoperability really across the biomedical, health and social science space, allowing us to maximise the value for research. It will also support the government strategy on building the UK's success today in developing a world-leading digital economy whilst facilitating use of data and overcoming silos. This will benefit data users and maximise value for research and policy. So from ESRC's perspective then, this investment responds directly to the recommendations made in the Longitudinal Studies Strategic Review that we commissioned in 2017, which suggested establishing a broader longitudinal data resource to facilitate work across the studies. It also aligns with ESRC's developing strategy for data and infrastructure and will form part of delivering the ambitions for that strategy. So importantly, a crucial part of driving the delivery of this will be drawing on the wealth of existing ESRC data infrastructure investments, policies and practices, and really learning from them. And ESRC really wants this initiative to enhance the use of the data infrastructure that we fund to support research activity in social science as well as more broadly. This will be critical to addressing the major challenges of our time. As Andy already highlighted, we know that to achieve significant health improvement, we must consider the social context, and social and economic policies must include health outcomes. So I'll pass over now to my colleagues at MRC and Wellcome, who will speak more specifically about their strategic ambitions and priorities.
Hello everyone, I'm Catherine Moody from MRC and I'm delighted to be here too. It is quite an important day. So MRC are behind Population Research UK because we want to see much wider use of the rich longitudinal population study data that 60 years of MRC investment have generated. What we want is for all researchers to be able to access data on the social and environmental context alongside the health-related data, hence the partnership. This is not only about new research insights, and I want to acknowledge and say that we owe it to the people who have donated their data to these studies, to use those, we owe it to them to use those data well and widely, for both for maximum research excellence and ultimately for benefiting health and well-being. We've estimated that over 2 million people have generously contributed to research in this way. So while we funders have established a number of great initiatives along the way, as Andrew mentioned, like Administrative Data Research UK, Closer, and most recently for MRC, Dementia's Platform UK, we need PR UK because only some LPS data are interoperable. And we want all the LPS data from studies that we fund to be both discoverable and accessible. So the reason for today is that the funders want PR UK to be designed around researchers' needs, and it's important to us that it will be a national resource and supported by our three-way partnership. We're very pleased that HDR UK has risen to the funders' challenge, and we're looking forward to seeing the results of this development phase. And I'll pass to Mary.
Great, thank you, and hello everybody. I'm Mary De Silva and I'm Head of Population Health at the Wellcome Trust. So I want to completely second all the comments made by our funding partners and also by Andrew, and just to talk a little bit about how this fits with Wellcome's strategy. So as some of you know, Wellcome launched a strategy for longitudinal population studies in July 2017, and we had a somewhat ambitious vision to work with partners to create a globally connected network of large longitudinal population studies with multidimensional data from diverse populations. And to achieve this, we need to ensure that the individual studies are discoverable, accessible and widely used, and that they're also linked together and into routine sources of data. Internationally, we're working with the International 100,000 Cohorts Consortium to work towards that vision. And in the UK, Population Research UK really is the cornerstone of how we want to achieve that in the UK. We are very keen that this includes resources from across the 4 nations, and that this national data infrastructure is integrated, interoperable and flexible, and maximally be used by the wide range of researchers from the broadest research communities that we support. In its most ambitious vision, PR UK could essentially create a UK-wide super cohort linking existing resources together and linking those resources into routine health, social and environmental data. And it is an ambitious vision, and it can't be achieved without working together as funders and with you, the scientific community, as well as with the public and policy makers. And so today is really the start of this broad consultation, and it's a meaningful consultation. So we haven't decided the form that PR UK will take. We haven't designed how best it can meet your needs. And we haven't agreed funds for the project, only for this development stage. So what it looks like and what we request funding for completely depends on the results of this consultation. So we really look forward to hearing from you as to how PR UK can be best designed to meet your needs. We're excited about this. In a way, we've been thinking about this for a couple of years now, and I think we're in a very unique position right now because of COVID. The response of the UK LPS community to COVID has been absolutely outstanding, and for us provides proof of concept that this ambitious vision is possible. Developments such as the Common Questionnaire to prospectively harmonise data collection on COVID across cohorts, which is now spread internationally, the work of Closer, linking research to policymakers, the new national core study, which is creating a UK super cohort for COVID research, and the huge success of the Zoe app created by Twins UK and Zoe are all examples of how the research community has moved on, the world has moved on, and now is a really good time to capitalise on that to create a coordinated national infrastructure for population research. So today's launch event is a really important step in achieving our vision, and we really look forward to working with you over the next few months and hopefully into the future.
Fantastic. Thank you, Chelsea, Catherine, and Mary. So I'm going to talk through some of the sort of high-level thinking on PRUK at this stage, and then I'll introduce James to talk through some of the details on the next few months. So if you could just share the slides, please. Thank you, James. And as each of the funders has mentioned in the introduction, the purpose of this next period is to engage and consult and refine the model for PRUK. So it should be the comments at this stage should be taken in that light, that the early thinking will develop and change as we hear more from the community. So as you've heard, the mission here is to maximise the use and impact of the UK's longitudinal population study portfolio. So there's an incredibly rich range of studies across the UK, covering an incredible length of time, creating a real opportunity to enhance the capability here. You've heard earlier about some of the many investments in studies and infrastructures, and there's an opportunity with PRUK to further integrate these and take on a coordinating role. So over the next few months, we'll be participating in a design and dialogue programme to understand the form of PRUK that will best meet these needs and support delivery here. And the idea is that this will inform a funding call for the delivery of PRUK itself. Next slide, please. So this will take place from January to July, and you'll hear from James in more detail as to what that looks like. The idea then is that this will culminate in a specification, and you'll notice on the slide there it says specification or the possibility of a plural. And one of the reasons for that is because as we're working through this process, it hasn't yet been decided whether that will be an individual funding call or perhaps several calls for components or elements within PRUK. The other thing I should highlight is that the timelines there are based on elements outside of the funder's control, so public funding cycles. And if 2020 has taught us anything, it's that things don't always go to plan, and that external forces can have an impact on previously laid timelines. So if any of these change, we'll be sure to update those timelines and let you know. But this is the timing we're working towards at the minute. So with regard to the scope for PRUK, it's expected that the majority of the scope will focus on consented longitudinal population studies, which could include panel studies, cohorts, linked biobanks, and working across that spectrum of biomedical and social sciences. And of course, the scope and what will be the focus of PRUK will be naturally refined as the design and dialogue programme progresses, and we'll be using user demand, areas where there are advantages of working together and coordinating, and particularly the opportunity to enable research that isn't currently possible and provide new functionality as something that very much informs this process. So what would this look like as what are the long-term successes? We want researchers to be more easily able to find and access different multidisciplinary longitudinal population data sets working across biomedical and social sciences. Want to enhance interoperability and improve linkage using detailed metadata and common standards. So again, looking at that ability to work across multiple data types and domains. The aim with this is to be able to operate at scale and efficiently. So looking at being able to develop linkage in a way that goes beyond what an individual study could do. Longer term, looking at a scalable, trusted research environment. So again, providing that function to the community to be able to link and analyze data at scale, and further work across the social and health science sectors. So we believe that there is a significant benefit here ultimately for the public and population of the UK. So we believe that combining multiple types of data from across biomedical and social sciences, PRUK can enable high impact research questions. And as you've heard from, particularly from Andrew and Mary earlier, the response to the COVID-19 pandemic has shown just what is possible at a scale and speed that previously wouldn't have been considered. So there are a lot of lessons to be learned from ongoing work and activity in this area. And we believe that in bringing the community together, PRUK can take a role acting on behalf of this community to deliver benefits and efficiencies to individual studies. As you've heard, there's a large amount of existing work and existing research infrastructure across the UK, and here are just some examples to give a feel of that. And in addition to some of those you'll see on the slide, there's also the work with the individual studies themselves and the national core studies that Mary referred to in her introduction. Next slide, please. One thing to be clear on the scope at this stage is that funding that will be identified for PRUK isn't to fund specific research. The aim and ambition for PRUK is to develop an infrastructure and resource to enable other research. And naturally, this model and approach will be developed and refined as we work through the design and dialogue programme. So I've talked through a bit of the high-level overview, and I'll now pass over to James to talk through some more detail about the design and dialogue programme over the next 6 months.
Thank you, Ben, and good morning, everyone. I'm James Pickett with Health Data Research UK as well, and I'm the programme manager on Population Research UK and the one doing a lot of the delivery of the design and dialogue programme that we're going to move into. So I'm going to give you a bit more of an overview of what the next few months look like and some of the more practical ways that we'd like you to get involved with this. As you've heard from before me, a very ambitious vision and set of specifications for PRUK. And now there needs to be some work on the reality and getting that right and working with you all to do that. So HDR UK has been asked by the funders to lead this design and dialogue phase, which will start early in the new year and run for about 6 months, with the output being the core specifications that will be openly made available to the community to respond to. So I'm just going to unpack this design and dialogue program for you a little bit. So firstly, what do we want to achieve? Well, you've heard some kind of the building bricks of what we're putting into this and some of the shape of PRUK, but there's still a lot that we want to consult on what we've presented to you, as well as to really flesh out the detail of this. And you can see some of the types of questions that we really want to get into and discuss on this as well. What priorities should PRUK take on? What are the capabilities and functions that it should develop and that most meet what the community and research users and data owners need? The form and model that PRUK should take on, and and the issue of how PRUK will synergize and work together with other existing infrastructures. I think this is probably one, and just looking in the chat and things that are coming in, where there is clearly we're not putting PRUK into a blank sheet of paper landscape. And there are many very important initiatives that we've heard about already that the PRUK needs to complement, work alongside and learn from to do that. And that's the rationale for this building phase before we before PRUK takes its final form. So that's the what. Who do we want to talk to? We want to talk widely with these, kind of identifying these groups of people that we do want to talk with. So firstly, we do want to engage those of you that are that run studies, panels and cohorts that would be in the remit of PRUK. We want to understand what's required from you to engage effectively in such an initiative. And that's going to be a key area of discussion that we want to take forward. We obviously want to talk to people that want to use data in terms of the how, the what, and the why. And this includes a very large pool of potential users of data from both academia and non-academic sectors. With remembering that our mission is to increase access, so bearing in mind what new functionalities would help people. And we also want to talk with the public and study participants. We want to co-create solutions with them, and whatever PRUK ends up with, we need to have acceptable solutions that are both understood and are agreeable, ethically agreeable with our study participant members as well. So this just shows a little bit more detail about what will follow, and from January. So there will be a number of different ways to engage. There will be at least one, if not several, different online surveys. We will hold one-to-one and small group interviews with people to get their inputs. Several design workshops are being put together for later in the year. Public compulsion involvement, and also consultation responses. So we envisage through this period building this is iteratively, where we will start by consulting very widely and openly, and as we start to make decisions, we will play those back to you and to the wider community for your feedback and refinement, with the goal of reaching these core specifications in the summer. So I just want to say a little bit about how this program is being run and overseen, and to really underline the importance to us of this being a very transparent, open and public process. And I hope this webinar is an early example of that, where we're coming very honestly with you and saying we don't have all the answers to date, but we'll tell you what we have at the moment and where our thinking is going, and ask you to build on that. And so that transparency throughout the program is something that we really want to maintain as a high value. So this just shows a structure, and I'll speak to this a little bit in a moment, but we have a PRUK program board, which is represented, senior representative of the three funders that you've heard from, and their remit to be to consider and eventually approve the recommendations and funding specifications that we at HDR are creating with input from the community. And feeding into that more formally is a PRUK partnership group that I'll speak to in a moment, who are really a close set of more critical friends to the development of the program. And I'll click on and say a little bit more about that in a moment. In fact, I will say it immediately. So we've created a PRUK partnership group who are there to advise us on the engagement processes, and for us to be able to get a collective perspective from the different communities that they represent into the program, and to help us refine and make recommendations on the aims and the functions of the mission of PRUK. But we very much see this as a process where a bottom feeding up process, where these recommendations that we take to this board will again be fed in through the consultations and workshops and designs that we at HDR UK will lead through this program. So again, we want to do this very transparently. So minutes and key papers from those meetings will become all available on the PR UK pages of the HDR UK website. There's a link there, and we can put it in the chat as well. So that will be a dynamic page that we will build out as we go along over the next few months, and you'll be able to kind of see an update on the progress of the program. This board met for the first time yesterday. So as I said, this is a new process. We are sharing information with you at the very start. Just a further note on public and study participants in this. As I've mentioned, it's absolutely crucial that we do co-create PR UK with them and build trust in the final products that we're putting together. But we really want to recognise that there is exceptional engagement in many of the long-term studies that's been going on for many, many years with their participants, and we do need to learn and take from what's been done before and not try to run very short, slightly underpowered or crude kind of public and patient involvement exercises that in some ways try to supersede this. So there's very much a learning exercise in this. We have 2 members, if you would have noted on the membership, of public group members who are members of our partnership group to inform that. And part of the remit of the partnership group is to devise and develop the appropriate ways to involve the public and study participants in the development of PR UK. And you will, they're not available yet, but the partnership group terms of reference will become available on the PR UK website as well. So I've started to talk to this already, but just to start to bring this together. So the programme very much needs your engagement to succeed, and we would really like and dearly like your input into the designs of PR UK. I've outlined the ways that will happen. The best thing to, what we're asking you to do today is to click on the link, and if you follow that through, you are able to sign up to join our mailing list. So we will frequently keep in touch with you and tell you about both progress in the project and opportunities for engagement. So I think we've collected, some of you have given us those permissions as you registered for this today, so we will carry those over, but if you haven't, then please do register there. So I'll finish there, I think, and just say we want to play this out. This is a big opportunity that everyone has a meaningful opportunity to input into, and the funders know that there is a big opportunity here, and we want to get this right and shape this with the community, and that really sets the framing of this design and dialogue phase. So I can see my colleague has just popped that link in the chat for you there. So I think that's everything we wanted to say. So now we're going to move to some questions and answers, in which case we will take the questions we can and give the answers where we can today. And those that we're unable to do, we will take away. We will develop some questions and answers for the website, or feed them into the consultation process as well. I can see there's going to be some really good thorny questions that are going to be things we're going to have to tackle over the next month. But let's pause there, and maybe if all our panelists could rejoin us, then we can work through some of the questions. I can see we've got quite a few there. Okay, I will stop the screen share. Brilliant.
So James, I wonder if it's worth picking up. I see a theme in a few questions coming through the chat. So for example, one here from Frank Popham saying UK Data Archive already curates many of this. Wouldn't it be simpler to directly fund UK Data Archive? Also from Mel B, possibly, is that Scary Spice there? And a similar one from, or similar, answering a similar theme from Closer, saying, you know, we believe Closer also covers this remit. And so that's part of the reason that close engagement with the existing elements of the infrastructure is an important part of the design and dialogue process. And I expect there'll be many others on the call who would, if they haven't already, put in a question or comment saying, we believe this infrastructure or current infrastructure already achieves these aims. And what I would say is that there isn't an expectation at this stage necessarily that PRUK should be creating something brand new, but instead be about building on and building out existing infrastructure and investments where that is appropriate and required. So certainly there isn't an expectation that everything needs to be brand new, with no desire to reinvent the wheel. But a key part of the design and dialogue process is to look at where those needs are and what is currently in place, and how we can address those, and where it's more cost effective and sensible to extend existing investments, then that absolutely should be the case. I don't know if anyone else on the panel has anything to add to that. No.
I would just add, we've talked about the importance of visibility of longitudinal population studies, and that is a key consideration as we develop this, that both nationally and internationally, there is a seen go-to place for people who are interested in this, and that's something for us to consider as we develop this, whilst wanting to very much align to other initiatives as well.
Thanks. So if we just work our way down through the questions, then there's a question here from Peter Tennant about the risk of underappreciating the importance of data lineage, given the kind of history and provenance of various data sets. So I think that's, I guess, less something with a neat answer and more an important consideration for the operation of PRUK, that simply sort of linking and mashing things together for the sake of scale isn't necessarily the right way to approach it.
Perhaps I can answer that as well, Ben. I mean, what we're not suggesting is that we have, when I use the word UK super cohort, what I didn't mean is that everybody's data would be all linked together and all halved together. It would be that you could treat the patchwork of resources, which all have their own lineages, together to answer overarching research questions. So, for example, we would not be suggesting that you create a single database with all of the cohort data. That would be, as well as physically impossible, it would also be scientifically undesirable, as the question states. What we're talking about is an infrastructure which allows you to access the individual data from cohorts, which makes it therefore easier to do meta-analyses effectively of the data from those cohorts. And where possible, if there is harmonization or if there becomes prospective harmonization, then you can create that. But harmonizing the data from across multiple cohorts is definitely not the purpose of PRUK.
Thanks, Mary. So we have questions are just moving around here. We have one from comment from Janet Kidd saying consider working with NHS Digital as their key to promoting linkage with health data. Yes, absolutely. We couldn't agree more. That's they're an important stakeholder in this. Comment or question from Diana here saying that we haven't talked much about training and capacity building for scientists, and there's a feeling there that this is a need that should be addressed. I think that's absolutely some useful input for the design and dialogue process, and something we can work through as we build out the model. Mary, I've just seen you go off mute there.
Sure. I mean, this is one of the key parts of the consultation. We hadn't thought that capacity building would be a huge part of PRUK, but it's open for consultation. Closer obviously does capacity building activities and play a very important role in that. So we have to think what would be unique about PRUK. The primary goal is to create this national infrastructure So we look forward to your views in the consultation on how you think capacity building could be best supported through existing as well as new structures.
Thank you. Another comment here from Mel saying that one of the things that is needed is to make it easier for students and early career researchers to understand the relevance of longitudinal data. Yes, absolutely. I think that, again, thinking of that role in coordinating or operating on behalf of the community, that could be a very useful function. A question from Lee about whether this is designed to be mostly academic or do you envisage including charities and private organisations as data controllers? So certainly there's an expectation during the engagement that charities and private organisations would be involved in the user space. That's an interesting question about their role as data controllers. So I think one potentially for us to pick up. I don't know if anyone else in the panel has views at this stage, or if that's something we could take away.
There's a lot of charities who are data funders as well. CRUK, Welcome is a charity, BHF, a lot of the charity funders in the UK fund large-scale cohorts. And I think there's a question further down about involving other funders, and I think that is something which we as funders need to reach out to all of the funders of UK cohorts. This is not meant to be just the cohorts funded by the MRC, the ESRC and Welcome. It is all appropriate resources in the UK, across the 4 nations of the UK, no matter who you're funded by.
Thank you. Just while we're doing this, James, would you mind clicking done for any of the questions that we have answered so that we can curate this list?
Yes, I think we're down to another area where lots more work is needed, is making linked admin data more discoverable and accessible. Any thoughts on this? I mean, this obviously touches on ADR's UK's mission, and we will look at this within the scope and pick up where the gaps are and where this is being covered at the moment.
Yeah, discovery and access are very much key parts of the PRUK mission.
Yeah.
Had a question.
Yeah. Sorry, maybe I can just, again, I don't want to be the only person speaking, but in terms of Welcome's, part of Welcome's rationale for wanting to do this is the problems we've had with linking health data, routine health data. ADRN has done such a fantastic job in the social and economic space, and we need to, that's one of the reasons why we're keen for HDR UK to be involved, because you do have those links into NHS Digital. Whether the problem can be solved by PRUK is a whole nother matter, but we see it as a step along the road to improving linkage to routine healthcare data.
We have a question here that's shot up the leaderboards quite quickly. So how does this differ from the previous PRR initiative, which already completed a similar phase 1 of stakeholder engagement? So could someone just quickly in a sentence summarize for us PRR and tackle this question?
I guess I'm
Okay,
happy. Sorry,
I mean, the simple answer is they're exactly the same thing. We changed the name. So Population Research Resource was the old name, which we renamed Population Research UK. And the phase that the consultation phase we went through before was extremely helpful in getting us to the stage where we could commit development funds. So we've now committed funds to this phase to actually fully work up what it will look like and how it would be funded in the model. So it's exactly the same thing, we just changed the name.
Are there any differences that anyone wants to highlight? I mean, we've spoken, we have a very clear goal here in what we're trying to achieve. We have earmarked and identified potential funds that can support this, which is very much wasn't there in the past. We've committed to this being a very open and transparent dialogue with opportunity for everyone fall in. Are there other points that anyone would highlight at this moment? Or I've given you
I think that's it seems fairly clear, and that's certainly something we can revisit. I see a question here on are we confident that 6 months is enough time for the design and dialogue process? Yes, I believe so. I think that certainly is in holding ourselves to account for that period of time is what's needed to be able to drive this through. So that's the journey we'll be on over the next few months. Looking up again, one that's been upvoted here, a question about sustainability. So has there been thought to sustainability? Yes, that is something that's has been thought about, and potential routes for that, including longer term funding through public sources. So the idea that the sort of phase 2 of PRUK from the ESRC, MRC and Welcome funding will be over approximately 3 years. But the idea is that the PRUK itself is intended to be a permanent fixture or element of infrastructure. So we're sort of concurrently exploring longer term funding options. Question here on design and implementation of the design dialogue phase. Will it be done internally by ADR staff? I assume that's actually HDR UK staff that's a reference to. Will it be outsourced? How many interviews and workshops are you envisaging? There'll be a number of different approaches. So there'll be some in-source work, some specific elements of that are expected to be contracted, and the interviews and workshops. We have some ideas at this stage, but I expect that'll adapt and change as we work through plans with the program board that is overseeing the approach. Another comment then about links to UK Data Service or Dementias Platforms UK. Is it sort of different or exclusive, or might it be inclusive? I think again that just a similar sort of response to the question from earlier, that the aim is not to sort of be exclusive or in competition, but where there's an opportunity to work across those, then we'd certainly aim to do that rather than sort of reinventing infrastructure. A question here about, again, linking to another study, I think, or initiative. I think that's Scoper or SEOPHR. So again, that's an important one to feed into the engagement process.
So Ben, I can respond to that. So I sit on Scoper. For those that don't know, Scoper is, and sorry if I pronounced that wrong, I still don't know. It's the Strategic Coordination of the Health of the Public Research Group, and it is chaired by Chris Whitty. Sorry, it's chaired by Anne Johnson, but it's got the heads of all the major research funding agencies that fund population health in the UK. And we've had presentations already about PRUK to Scoper, and we will absolutely keep the board closely involved in the developments, and we can use them as a sounding board for the results of the design and dialogue phase as well.
Okay.
Thank you.
We're moving around the questions as it's not a static list that you
well, if you could click done,
and they disappear.
So James, that this is a comment to you. If you could click done on the questions that we've answered, they'll disappear from this column into the answered column.
Okay, we've answered way more than 6, haven't we?
Yeah, so if you can just click done, I'll work through the questions.
Okay, brilliant.
So there's a question here from Claire about participants in the public say about trust, particularly in that link to, oh, it's just disappeared for me now that Was that question gone?
That was me clicking done, Ben. Apologies.
Yeah. Okay. So I think certainly the gist of the question was about linking to the sort of existing trust that's built up with the participants of an individual study. And yes, absolutely. And that's why we don't want to sort of run roughshod over the existing communities. So the aim is to work kind of with that federated network. And sorry, I think someone's just fallen down the stairs outside my flat. Please excuse me.
And Ben, if I can add, we're obviously talking to, oh gosh, someone really did. We are talking to understanding patient data so that we can think about the wider trust issues of public trust in use of data for research. And obviously the COVID has again changed that landscape quite dramatically. We do have 2 public participants on the partnership board when we had a competitive selection process to choose those 2 people. And they have joined our first meeting, which is fantastic. So we are really trying to think about the implications of PRUK for public trust in data, not only just trust in data from the participants in individual studies. So it's a core part of the scoping phase. And again, your inputs into that are greatly appreciated.
We have a question here, a couple of questions I can see about, again, working with the other research councils. This is something that we're very committed to do. We've had discussions through our funders with NERC and EPSRC, and we will be reaching out more formally and having these discussions about the data sets and their perspective on this, and to bring that into this. That's very much in the intentions of this programme. We've got
a question here about how it links to routine health, social and education data, whether that's a longer term plan or intended to be kept entirely separate. So certainly at this stage, the aim is to be inclusive on the types of data. Part of what is behind the mission for PRUK is looking at the potential of working across different domains. So we're not excluding things at this stage, and certainly there are a number of opportunities in links with routinely collected data.
And again, to add, the rationale for us for PRUK is not only to link the together to make them more discoverable and accessible for people to use data from individual cohorts more easily, but also to make it easier for the cohorts to themselves link to the routine sources of data that they want to use. We're very aware that cohorts spend a lot of time and money and effort trying to get permissions to link to various health, social and environmental data. And so if we can create a data infrastructure which makes that process easier for individual cohorts, then that would be a huge benefit of PRUK. We appreciate it's very difficult, but that is one of, certainly for Wellcome, and I think for the other funders as well, one of the key rationales for creating this coordinated data infrastructure, so that there are significant benefits for individual LPS joining PRUK because they get faster access to linkage resources.
And we've started to discuss other features along those lines that could be built out as well. For example, be able to negotiate en masse with commercial suppliers or industry suppliers to convert samples into data. So we're not saying that that is a function that the PRUK will take on, but it's something that has been suggested and something that we would build into the consultation, look to see if that's something that has value to the community, and again to build out a list of those kind of activities that the PRUK may be able to take on centrally to support the LPS studies that are part of it.
So perhaps we should have said at the beginning, earlier in the day, but the purpose, we understand it's a lot of work and effort for individual studies to want to join PRUK, and there is no point studies doing it unless they get a benefit back from it, and that's benefit in terms of save time and money and effort, but also scientific benefit. in terms of access to other similar data sets for you, and access to other collaborators, so that you can ask scientific questions not only of your own data but of other people's data as well. So we want this to be designed in a way that's mutually beneficial for the owners of the data as well as the users of the data.
So we're currently at 11:56. We've got a couple of minutes left, and I can see 24 unanswered questions in the chat. So we've got plenty to take away and share through the frequently asked questions documents that we'll be updating on a regular basis. Having skimmed down through the questions, I can see a mix of some of the themes that we've covered already about linking to existing aspects of the infrastructure. Some of the questions are clarifications on things that might or might not be included either within the scope of the programme or within the scope of the design and dialogue process itself. And then other kind of comments on experiences working with existing studies and existing data and things that will be important to consider and develop within the model of PRUK itself, as well as kind of suggestions or comments on other, whether it's studies, initiatives, or user groups to look at. So I think there's a lot here. I'm seeing some really good engagement and interest in the initiative, and so I think rather than sort of running over and abusing your time, I'm just going to ask anyone else in the panel to come in if there's anything that you think we need to cover urgently in this session, and if not, then we will draw this to a close. So just looking at my fellow panelists, I think we've got plenty to take away and work through, and I think it just remains for me to say thank you very much for engaging. So thank you to the panel with me and Andrew, who joined us earlier. Thanks for all of you participants for all the questions coming through, and I look forward to working with you over the coming months. Thanks very much.
Thank you, everybody.
Thank you.
Thank you.
Bye.
Thank you.